our witnesses here today for your valuable testimony. Like many of my colleagues, the cost of health care is one of the top issues I hear about from constituents back home in Central Illinois. While this committee has made strides towards increasing cost transparency and empowering patients to make their own health care decisions, more obviously can be done. We have an opportunity to come together on this issue and truly help our constituents afford health care services through greater transparency, innovation, and free market principles. During my time on the Ways and Means Committee, I have taken an active role in advancing health care policies that improve access, choice, and affordability for my constituents. In rural counties in my district, access and choice to options for health care services can be a significant challenge. Additionally, the current inflation crisis underscores the need to give patients more flexibility with how and when they pay for out-of-pocket health care expenses. That is why we should look at many different options, including further support for health savings accounts or flexible spending accounts as a tool for families to make personal health decisions. I have led and supported several pieces of legislation aimed at expanding the use of HSAs and FSAs, including the Dietary Supplement Tax Fairness Act last Congress with our colleague Representative Boyle of Pennsylvania, and Mr. Kelly's Personal Health Investment Today, or FIT Act this Congress. These bills expand the options for use of HSAs and FSAs, including for preventative care and wellness, allowing for more patient choice in how they pay for health care. I look forward to continuing to work with my colleagues across the aisle to improve our health care system so that it serves all our constituents. When we work together, we can find common ground to create more choices, increase transparency, and bring down costs for Americans. As to a question, Mr. Short, in your testimony, you mentioned the need to address key issues in the U.S. healthcare system, including how the interaction of increased price transparency affects the utilization of HSAs. With that, can you spend a bit more time discussing the relationship between the benefits of expanding tax-advantaged healthcare accounts and how they can support increased price transparency? Thank you.
There's many things that I don't know, but one thing I do know. If individuals don't have the incentive to ask questions, they won't. And tax-advantaged accounts, including health savings accounts, is a vehicle by which we can actually look at an issue that we're not really talking much about, and that's the inefficiency in payment processing, which is a huge issue in the U.S. healthcare system. So by expanding health savings accounts, coupling with price transparency tools, getting FSAs and HRAs also to be expanded, we'll be able to give more optionality to both individuals and employers, no matter if they're public sector, private sector, and everything in between, to be able to have more weapons to be able to at least ask the question of what things can cost, at least for items that are below the catastrophic deductible.
And what current barriers do you believe have the most impact on patients being able to effectively utilize their HSAs?
Well, a huge barrier is, as we've talked about today, what is the price of care? What does it cost? And I think more and more we can do in terms of price transparency to arm these individual consumers can only be a benefit in allowing for them to deploy their resources as they see fit for the care that they need.
Thank you, Mr. Short. Those are all my questions. I yield back, Mr.